Now on to this. Earlier this year, the Department of Health told Parliament that South Africa's public health facilities have lost over 125,000 healthcare professionals, ranging from doctors, nurses and pharmacists and other medical administrative staff since 2013. Recently, Charlotte Maxeke Academic Hospital has seen a rise in the resignation of specialist doctors such as cardiologists and ENT specialists. Inquiring about the recent resignations, the department told Daily Maverick that the resignations would not disrupt operations in the respective divisions and that the positions would be filled by January next year. Is this a looming crisis in Gauteng facilities? Vice-chairperson of the South African Medical Association, Dr Zanele Bikitsha, gives us some perspective. Doc, a very good morning to you. Thank you so much for your time and for being with us today. What's your assessment of the current status, especially when it comes to specialist doctor retention in the Gauteng public health sector? And what are the key factors that you think are driving this exodus of cardiologists and ENT specialists?
Well, I would take it that we are losing doctors, and the main driving factor is austerity measures that have been put in place. And they have been trying to make savings by cutting the wage bill. Now, unfortunately, that means what is on the ground is unable to deal with the headcount. So that's basically one of the first issues that is causing this, the ongoing austerity measures. Then another issue about why we're realizing it now in specialists. It takes 4 years for you to actually get a specialist. So when austerity measures started, they started not giving out posts. If they did, it would be 1 or 2. And we are now seeing the end of that, where you don't have specialists that are able now to handle the service platform. And it's also one of the issues of investment in infrastructure. Within our infrastructure, we've got outdated equipment. We have malfunctioning systems. I could want to do a Caesar only to find that we don't have a blood gas machine, or the scope that I need is broken and was not fixed by SCM. So there's a lot of issues that are not just about the money, because yes, everybody would like to get an increase, but it's also about coming to work and being able to practice your craft. Most of the equipment would be outdated, so they're unable then to execute what they've been taught. So that is one of the frustrations. And this doesn't just have an impact on them, it also impacts the junior doctors and registrars. Because if you remember, medicine is a bedside teaching profession. So if there is nobody who is supervising the registrar, preparing them for their exams, because that's your way to specialty, what is going to happen?
Right.
If you don't have a specialist overlooking the department, lots of mistakes will happen that will be uncaught because you don't have the necessary skill to be able to pick up something quickly. So it affects the service platform, it affects teaching. Then lastly, it also affects our patients. Patients are now on a very long waiting list. We've got auto lists going into mid next year because there is just such a shortage. Now, with certain conditions, the person might be electric, meaning we're going to do this, but when we get time, it's not urgent. And because of the time that they have spent on the waiting list, they've now become emergency cases. And I'm sad to say some of them have demised.
I mean, it's a very sad situation, Dr. Bikitsha, and you make mention of the infrastructure issues that persist. I mean, even in the article in the Daily Maverick, they speak about how at the Charlotte Maxeke Hospital, there's a shortage of ICU beds. At some point, some operations that have been scheduled are then cancelled at the very last minute, seemingly because there's just not some of the apparatus that's needed for some of these to continue. Is this a lack of will from an administrative perspective for certain things to just be working?
Well, you can say lack of will, because certain times when you look at programs where the public puts pressure on, the department, suddenly there's budget to execute that thing. But at the same time, because we believe as SAMA that we need to be partners in making sure that this health system is functional and working for NHI, because this is our health system. We understand that they need Treasury to come on board. They've got homework to do at the department to figure out their staffing norms and needs, because as they are currently not being paid per patient head count. So you will never ever be solvent if you're always working from a deficit. So yeah, there is the lack of political will, but at the same time, the HPCS and the Treasury need to come on board and make sure we plan a way forward on the funding of healthcare.
And I mean, when we further speak on the impact on the patients, particularly those in the public sector, who are we losing this special skill to? The cardiologists and the ENTs, when they move from our public hospitals, where do we see them going?
Look, the problem is, if you looked at the list from the DOH, which tells you how many people are now in private practice and all of that, it would not necessarily divide them the one that we have. They do have a database as well, which will tell you how many staff they've lost from 2013 to date. I think it's somewhere in the region of 125,000. So the numbers are there, but it would take somebody sifting through them to be able to pick up which are the areas where we are hemorrhaging the most.
Yeah.
Currently, the one that is making a noise is surgery, it's orthopedics, it's anesthetics, and then obviously pediatrics. Those ones are making the most noise right now. But until we actually get evidence and look at it, we would not know. And most of them, they do go into private practice, or they do find, what can I say, whether you call them NGOs or something, where they work together with them.
And it's quite concerning, but Doc, I mean, what would you then place in terms of ethical and professional considerations? What would you say are the ethical responsibilities that our healthcare leaders, and especially those that are policymakers, in addressing particularly the human resource crisis that we are facing in our public hospitals?
Look, I think, let's start with the department. I think by now the department has more than enough evidence to make a case to say that what we are doing is not working and is actually leading to patient deaths. I think they've got more than enough to make that case, and they should. They should, in terms of allocate or wanting to get more budget allocated. They honestly do. Then, if you want to turn it around to us, I think that our members have done it as ethically as they could. They didn't just wake up in the middle of a ward round and go. They gave their notice, they served their 1 month, and they were gone. They did it ethically and professionally. And on top of that, you also cannot expect that somebody is going to be in a working place which is just unproductive.
So
A lot
lastly,
of these people, if they have to get states from EAPs, you'd be surprised of the pressure that they are under.
Most certainly. And are there alternatives, Doc, with regards to maybe technology and innovative solutions where we could look at telemedicine that could really alleviate some of these specialist shortages that we are facing in the public facilities?
Yeah, I'm going to say yes. My qualifier is that IT will never replace a doctor. That's what doctors need to not be alarmed about. IT will never ever replace you. If anything, IT is here to, let me say, lessen your workload. There's a few programs that I've had a chance of looking at, from consultation apps to diagnostic apps to apps that will interpret a CT, things like that. We already are doing, microscopic surgery. So definitely there's a lot that's going out there. And if we were serious, we could start preparing ourselves for that now. Because by the time that private rolls it out, NIH or not, we just simply are not going to have the equipment. But there's a lot of interesting things that are coming out. I won't lie, I've had the benefit of being able to have them displayed.
All right, Doc, thank you so much for your time. Certainly is very concerning given the number of lives that we are losing, and unnecessarily so, because of this shortage of staff, especially in those specialist areas. Thank you so much for your time this morning. That was the South African Medical Association, Dr. Zanele Bikitsha.